Alright guys, I'm going to do a quick tutorial on how to do a flu encounter. So if you're working in the flu clinic, you guys need to make special notes about this type of encounter because there's some things that are pretty new. Alright, so when you room a patient, you'll be in the exam section. The first thing you need to do is you need to go back into your check-in. Okay, so how I do that, I just scroll over here in check-in and click it. The next thing that you need to do is change the rendering provider. You're going to change it to who you normally work for and who you have permissions to call in labs, medications, and vaccines and injections. So I'm logged in as test 44. I work for Dr. Combs normally, and I need to change this rendering provider to Dr. Combs. Okay, this lets me give the privilege to sign off the flu injection and so that Dr. Combs can review it. If you don't have a rendering provider selected and you forget to miss this step, you're not going to be able to sign off the injection and we're not going to be able to bill it out. Okay, so it's really important that you guys choose a rendering provider. Once you do that, you click save, and then you can move back into your exam section right over here by just going back over here and clicking exam. Alright, now everyone should know this step over here. I'm going to go over it really quickly. So I'm going to do the vaccines for the flu shot. So I'm going to go to diagnosis order set, type in vaccine, select the flu, scroll down. Diagnosis is here, the assessment and plan, the code, ICD-10 code is here, the flu Viron order is right over here. I need to put in the lot number and the expiration date, and I need to press documentation only because I do not want to delegate this task to anybody else. I am working in the flu clinic, I am going to be giving this injection, so there's no reason for me to not delegate or to close this order. I don't want it to go to anybody else. This influenza vaccine care instructions, you guys need to make sure that you're not deleting this. Don't delete this. You need to put documentation only because we are giving patients the white form that has all of the flu instructions and information about the flu. Okay, so make sure you press documentation only on this one as well. Once I do that, I can sign the order and save it. Now the next step I need to do is I need to go up in the sign off stage over here, and this is going to be new for everybody. So you go into the sign off stage and start sign off. Okay, I want to close this encounter. Now in the other video I said that you should never close an encounter, and that's true. You should never close an encounter in which the provider is seeing that patient. However, this is the flu clinic. The provider doesn't need to see the patient, and they're basically coming in just to get their flu shot. So in this case, and only this case, you would close an encounter. So only close encounter when the patient is here and you're doing a flu clinic encounter. Otherwise, you would always move it to review to Dr. Combs, for instance, when you're trying to do a save and amend encounter. But this is a flu encounter, and I'm going to close the encounter and press save and next. The last two things I need to do in the billing section over here. So the billing section is kind of similar to what we used to have on the green tick. We always check mark the box, the 90658 and the 90471. There's one other step you need to do. So for the E&M code, I want to put 99211, which is the nurse visit. Once I do that, I want to uncheck this. It's basically asking me, do I want to bill? I don't know. I'll let the billers do that, okay? But I need to keep an E&M code there. So I'm going to uncheck this. Then if you scroll to the flu Viron in this box, the moment I click into this box, it populates the charges that I need to put in. And I need to choose the correct one. So there's 4 different ones. This one is the combination. It's a 90658, which is a flu vaccine of ages 3 and over. It's a 90471, which is the first administration of the immunization, or a 90472 for any additional. Okay, same thing here. 90658, 90471, 90658, 90472. If it's the first one and the only one, I would pick the 90471. If they're here getting a flu shot plus a Tdap shot, then I would use the 472 to use an additional. Alright, here is the children's flu vaccine, 90657. This patient is 38 years old, so I'm going to pick this one. Alright, notice how it's inputted automatically. Again, bill, question mark, just leave that unchecked and we'll let the billers do that. Last step, billing tab, review and complete, press save and marked as review. I'm sorry, there's one more step. Then go to checkout above here, start checkout, and done with checkout. And that's how you do a whole flu visit, okay? If you have any questions, let me know. Thanks.